Welcome to the Matt and Dale podcast, episode 15.
Dale, welcome everyone back to the Matt and Dale podcast for another episode. And we've been having a bit of a debate of what we talk about, haven't we, Dale?
Yeah, we have. We came down to, well, there was another topic, but we decided to talk a little bit about labels, um, which can be limiting from what I see, and how I've experienced myself. So that was kind of not just clearly to talk about me, but to see how that might operate for everyone else out there listening and how you've experienced it too, Matt.
Right, and we're talking about how we feel with some clients it can be limiting, but with other clients it could be very validating. It can actually help them move forward because once they might have a label or a diagnosis, they all of a sudden have the potential to have supports and recommendations from other services to, help them at school or at work. So it can be
Yeah.
very helpful with some clients that I've found, but then other clients, it can be very limited, So if a client comes in and says, for example, I've got this, whatever it is, that means that I can't do this, this, and this. But then another client might come in and say, look, I've been diagnosed with this is my label, but I know I need this, this, and this to help me get through now because I've done some reading up on what this diagnosis is, what this label is, and this is what really helps me. So I think labels, depending on the person, can actually be really effective, like having a diagnosis. But then I think in some clients, it can create almost like a barrier, is what I've noticed in sessions. What
Yeah, I
about
mean,
you, Dale?
I mean, people, in my experience, when they're coming and they want a diagnosis, they want to feel better
Yeah.
and they're concerned about how they feel. And a diagnosis can be extremely helpful in helping us counsel that individual, in knowing what, the symptoms are and being able to take different angles in the therapeutic approach based on what the diagnosis is.
Mhm.
I think sometimes people want a diagnosis, and this is no right or wrong for any person coming to see us. This is just
Absolutely
our
not.
experience of how
Mm.
we see things, how things land for us. Because I think there's also a bit of an identity search as well with some people
Yeah.
who they kind of want to know who they are, and the diagnosis or the assessment, which leads to diagnosis, can confirm a little bit more about, who they are in this life as they walk forward. Um, yeah,
Yeah. No, I really feel like it's an interesting one. Um, yeah, I mean, for example, I might have a young person and they might have a diagnosis of ADHD and
mm,
autism, for example.
yep,
They might go to a school where sensory items might be completely banned, because it causes distraction and they call it like disrespect. You should be looking at the teacher. So as soon as there is a diagnosis there, we can develop a learning plan, and within that, they can have sensory items and
yep.
they can really adjust their day and have the right resources in place. And this actually helps them concentrate and it helps them listen. So I found it quite effective, especially with young people at school. Um, yeah, but also we are talking about like why do we need a diagnosis? Like, as in, if someone is struggling and if something helps them concentrate, then like why do we actually need a diagnosis to prove that? So we're sort of unpacking that a little bit too. So it's interesting, and
It
I
can
really
be. So go
yeah.
ahead, Matt.
I know sometimes I feel like uh, humans need a way to try and understand things. But sometimes I wish that we just get to a place where uh, if we see someone struggling and they need support, like we're just going to help that person.
Yeah.
But now it's like that person's struggling. Let's try and get them a diagnosis to see kind of what's going on with them. I just find it really interesting that happens in society.
Yeah, I don't know if I'm going to answer that question completely, but one of the things that's coming up for me is that, you know, people come to, obviously come to see us. Um, as clinicians, although that we're in a privileged position, obviously if it's the clinician doing the assessment, if it is to assess for a diagnosis, um, but there's also, I guess what you would say is a power imbalance that can form owing to that type of focus.
Mm.
There's also something that they could develop, like it's almost like I'm not well and I'm coming to see you,
Yeah.
and that's why I'm getting diagnosed. So it's got to be handled with I will call it like a trauma, a trauma informed
Mm.
care perspective. Um, because
Yeah.
I mean, I'm of the theory, and we're getting very philosophical here, but it's a good subject. But I'm of the theory that, okay, so you might have a diagnosis of something, but you're enough who you are right at this moment. And
Mm.
I think that's where you were leading to around everyone wants that help.
Yeah.
They want to be, they want you to see them as, that they're enough as they are.
I
And
love
although
that.
the diagnosis can help, the treatment strategy and treatment plan, etc., I think that underlying theme should always be present, no matter who you're dealing with in whatever situation in a therapeutic setting.
Exactly. And no, I completely agree with you. And what I say to clients, like the diagnosis can be really helpful, but I'm not interested what's
Mm.
on the jam label. I'm interested in what's in the jam, is what I like to
I like that.
what I like to tell clients. Like I'm really the label can be helpful to direct us, but at the end of the day, I really want to know, and I really want to guide them into finding who they truly are inside.
Yep. Yep. No, I completely agree. And I think, people can cut, and this, I don't want this to be controversial as well, because everyone,
Mm,
is where they're at. But I think overdiagnosis can also lead to crutches being formed. Now that could be controversial. Um, just to note for this podcast, and it's not something that I carry into any session, when talking of diagnosis,
mm,
but I don't want to have any limitations put on also via a diagnosis sometimes to achieve treatment outcomes.
yeah, that's
That
right.
somehow I'm not capable because I have, an extreme amount of anxiety. Now that needs to be addressed, that way of being, where they're coming from. But
Mm,
I think ultimately, if they want to, if that person wants to progress themselves,
mm,
again, we've got to see them as more than they think they are from a diagnosis perspective. So then that allows them to open up about, around what is possible. And I think that's where you're coming with the jar scenario, if I'm not wrong.
mm.
The jam jar.
The jam jar, yeah, yeah,
Yeah.
yeah, yeah. No, it can definitely be helpful, and once again, I've seen it helpful with clients. They get a diagnosis, and then they might start medication, and that kind of helps with them moving forward as well. So I've definitely seen two sides of the spectrum, so to speak.
Yeah. And look, I've had clients also that, and again, it is a, like absolutely, it is a choice and control situation. in any therapeutic setting, as long as it's not harmful towards that person, and then we've got to talk about it, right? But so I have a client, I'll just try to keep it as general as possible, but he did have some anxiety medication. When he went to see a doctor to get the prescription, based on the fact he was experiencing some pretty extreme anxiety symptoms.
Mm.
But he realized, through the process, still following doctor's orders, he was still on the prescription, but he said, this, I don't want to not feel anything at the same time.
Mm.
And then he reapproached the doctor. Um, we were doing therapies in, non-pharmaceutical therapies, clearly,
Yep.
whilst he was going through this process around helping him with those systems or reduce those symptoms.
Mm.
Um, and he decided that he wanted to come off them. He talked to the doctor, and the doctor obviously said to stagger, to stagger
Yep.
the reduction. And he again followed doctor's orders. He's now off the anxiety medication. And feeling better for it. Feeling better
Yeah.
for it. Not
Yeah.
to say
Right.
that that's the road for everyone, but in his case, you know, that's what worked for him in that situation. And for someone else, it may not work, and that's completely cool too.
Yeah, and that's the thing. At the end of the day, it really depends on the individual, doesn't it? And I'm sure we're both client-centered here. At the end of the day, we
Yep.
want what's best for the client. So if that's getting a diagnosis and that helps them move forward and grow, if
Yeah.
that's taking medication, you know,
Support them in
that
that.
that
Yep.
helps them succeed.
Yep.
Uh, at the end of the day, like I talk about medication with certain clients because I'll get the question, like, what do you think? I'm thinking about going on medication.
Mm.
And first, I say I'm not qualified to tell you about medication.
Yep.
But medication with some clients can be really helpful. And I love my metaphors, as you know, and I talk about medication is kind of like if we're climbing a mountain, it gives us warm gloves and a nice sort of windbreaker jacket. We've still got to climb that mountain. It doesn't necessarily give us a chairlift up. Uh, but some clients, medication might not help at all. So once again, I've seen so many different clients react differently. And yeah, some really progress and others don't see it helpful at all and actually regress through medication. And
Oh, absolutely. And I've seen it absolutely help other people too by
yeah,
having that medication. It's stabilized them. And again, I'm
yeah.
not in a position
Mm.
to advise on it. I understand, what some of the medications do clearly, and being in our role, that is a good thing to do. Of
Mm.
clearly, it's a really important thing to do, but it's consult your doctor. Consult your doctor or
Yeah,
psychiatrist or whoever it might be, who can obviously prescribe and assess and prescribe for these things.
yeah, yeah. Yeah, so it is definitely an interesting one, and I feel like the more that time goes on, there's just more and more diagnoses that keep coming up, and it can feel really overwhelming to a lot of people, and even something like ADHD, like it wasn't until 2012 that ADHD was recognized in women.
Yep,
And I thought that was really interesting.
that
So
is
there's
interesting.
there's been a lot of misdiagnoses. For example, bipolar and ADHD. And so if someone gets a label or a diagnosis, I'm this, I'm bipolar,
Hmm.
but it might not be even the right one, the right label. All of a sudden, that can cause some confusion and yeah, potentially can cause a barrier as well.
Yeah.
So it's difficult. So yeah, if we're talking about labels and diagnoses, I think it's important to have one that's actually correct as well. Because all of a sudden, if it's not correct and someone goes on their life thinking, I've got this, it could be even more limiting.
Yeah.
So
Absolutely.
that's why I really feel like it's important to just get to know the person and what works for them, not based on what we believe the diagnosis is.
Do you think it, and again, you need to be client led, obviously.
Mm.
Do you think, and this is again maybe a controversy, do you think it's our role to enable the person to understand who they are first and foremost, or at least that's the underlying process as to what we do?
Yeah, like I always say, if we're talking about labels, I'm a counselor. uh, but at the end of the day, we were speaking about this earlier. I feel like I don't even like saying that I'm a counselor because it labels me. I'm someone that helps guide people into finding who they truly are.
Hmm.
Like I feel like that is my job, really.
Well, it's funny because I see myself as helping or enabling people to remove the impediments
Mm.
to that are in the way of allowing them to see who they truly are.
Oh, that's cool.
So it's
I
funny, you
love
got the
that.
same one effectively. It's just
Yeah,
we're just kind
yeah.
of we've just worded it slightly different.
I love that. It's like what you're doing is sort of removing the boulders so that the river can
Yeah.
flow a bit clearer. Yeah, yeah, yeah.
And I
Wow. And
think
what?
that just happens naturally as you're doing our work. It's like
Yeah,
one boulder comes away, and then the next peel everything of the onion layer, and then it might be a little bit of an avalanche, and then that kind of moves. You get a little closer to the core.
yeah. Wow. So what would be one of those sort of boulders in the way of a client sort of progressing or finding out who they truly are, do you think? What's a common one that you would
Well,
find?
it's interesting, I mean, I'd even just say based on the conversation that we're having is that the diagnosis defines who I am.
Ah,
Because
yeah.
if, I'm not just saying, I mean, there are others as well, but if you wanted an example based on what
Mm,
we've been talking about, and I would definitely dispute that. Like
mm.
again, not looking to be controversial, but hopefully helpful. I would be saying a diagnosis is a diagnosis. It doesn't define who you are. Perhaps it's part of who you are. Um, and let us help you, kind of navigate in whatever way that you want to navigate that situation or that. And I'm not even going to call that an impediment necessarily, that because it may not be. Because you might get a diagnosis of autism and then go, okay, great, you have an autism diagnosis. What are some of the gifts that you have as a result of that?
Ah, yeah.
Rather than seeing it as an impediment, it's a clear, I mean, it's a clear reframe, and let's discover the person underneath, who's underneath that.
Yeah, I like that pivot. I really
Yeah,
love that.
because I
Directing it.
was
Yeah.
because I do think always a question of, for me, it's always a question, and we all come in with our worldviews, and as counselors, and we try to remain as person-centered as possible, but yet we're still a person. So we have, our worldviews, which for the most part, in a person-centered sense and strength-based approach, will help a person anyway if we have a stronger sense of identity. So
So important that, yeah.
it really is, because if you
Yeah.
don't, then, a diagnosis might stick to you as a I'm going to say as a counselor, as a person who removes the impediments of people seeing their true nature. I've got to be careful not to label you, Matt. Um,
Contradictory. Yeah, yeah. Yeah, yeah,
Contradictory, controversial.
yeah.
So, I think that it is always a question of identity. If we think those things define who we are, or we're going to have a probably a limited self view of who we truly are. Whereas if we can kind of get to the discovery of who we are, we'll see impediments either leave or be removed. Maybe
Yeah.
it's a reduction in anxiety symptoms or
Mm.
depression symptoms. And then the person who we are starts to rise, enabling us to let go of the impediments ourselves, i.e., the client allowing
Mm.
through the guidance of us allowing to, to remove those impediments. Um, and that's, I think, where the um, the power is
Yeah. Yeah.
in the
Well,
in the reframed identity.
yeah, it's great. And look, just from my own story and having anxiety, when I first started seeing someone about my anxiety, I was really limiting myself because I'd talk to my therapist and say, "Oh, look, I've got anxiety, so I can't do this, this, and this." And then I'll never forget it. He said, "Oh, it sounds like you really care about something there.
Mm,
That's why you're feeling anxious." And
yeah,
then all of a sudden, I had this revelation. I'm like, oh, yeah, because that actually matters to me. That's why I feel anxious because I don't want to lose it.
yeah,
So then I almost had gratitude for my anxiety. I'm like, that means that I actually like give a stuff. That's
you
really
care.
cool.
So that's
I
part of
feel
my
it.
nature. I
Yeah,
care.
I
That's your
care a
true
lot.
nature.
So then, that was an
Bang, that's it.
impediment. That was an impediment that I had. I went into session, you know, I've got anxiety, so I can't do this, this, and this. And when that therapist said, "Oh, that's amazing that you care so much about those things," it just completely blew my mind.
Yeah, I mean, maybe, and there's also a tie-in of that's amazing, Matty. I love that. I love those epiphanies we get. And then there's also an element of your sensitivity, in terms of being caring as well. And then the sensitivity, rather than being seen as a negative, is a sensitivity which enables you to more truly appreciate and understand your true nature.
Exactly. Like, and it's, yeah, no, I appreciate that, Dale. And once again, it depends on how we look at it. Like, I grew up, being called, "Yeah, you're too sensitive, you're oversensitive." But growing up now, I realize that sensitivity is a beautiful thing. It's a beautiful trait to have. But growing up, I always thought it was a negative. So
Yeah,
the anxiety, I just thought, "Oh, I'm oversensitive. I shouldn't be feeling anxious."
yeah,
But as I started to get older, I realized that, wow, that's actually kind of cool that I can feel like I'd rather feel anxiety and feel those things than actually feel numb, feel nothing.
yes, yeah, yeah. It takes yeah, and you don't want to dull that sensitivity anymore.
No, I think
I mean,
it's a
it
great.
can. I mean, you can feel and everything, but you don't want to dull it anymore. In fact, you probably want to enhance it because then you're going to get more of a true appreciation of what's going on around you.
Mm,
And again, I think with that reframing, the sensitivity can be such a positive
mm,
enhancer
mm.
of our life experience, right?
Yeah, yeah, and I just, that just reminded me from that story that you told, with reframing the neurodivergence, whether it's autism or ADHD, and go, "Oh, cool. So, you've been diagnosed with this, you know, what does it mean you're able to do?
Yeah.
How are you able to think differently to everyone else? And how cool is that?"
Yeah, what
So I think,
strengths you have, like like just the authenticity that's coming through you right now is like amazing. What a gift.
yeah,
I mean, sometimes it's the like, and I don't want to stereotype people with autism, but sometimes the filter or the lack of filter and that pure honesty just shining through is like it's like a revelation.
yeah, yeah, yeah,
Uh
yeah.
yeah. That I think all like all of humanity could really deal with in a lot more doses.
Yeah, so yeah, a diagnosis, like we're going to have to finish up. I've
Yeah,
got a
let's
client,
wrap it up. Yep.
but yeah, like a label or a diagnosis can be helpful, and it can be also limiting until maybe we start to reframe it. and
Yeah.
look at all the positives that actually can come out of that label or diagnosis.
Yeah, I think that's a fair way to wrap it up. Thank you so much, Matt. That was an awesome conversation.
Thanks, Dale, as always. Yeah, and we look forward to seeing everyone in the next episode.
Yeah. All right, mate. Take care.
Okay. Thanks, Dale.
See you, everyone. Bye.
If you're wanting to book an appointment, you can contact Thrive through email or phone. And if you're needing extra support, here are some helpful numbers. And remember, you're never alone.